Hey girlfriend, this is Jan James. Welcome to the Hope After Breast Cancer podcast, where women who have endured breast cancer learn to have fulfillment over frustration, clarity over confusion, and faith over fear. We tackle the issues that many of our sisters face after a breast cancer diagnosis, from brain fog to fear of recurrence, from menopause to sex after breast cancer. This is the place to learn how to have hope after breast cancer. So strap yourself in. Welcome to the Hope After Breast Cancer podcast.
Hi, good morning. My name is Kristina Calligan. I'm a family nurse practitioner that specializes in women's health. I would like to thank Jan and the group for asking me to do more videos on the topics of painful intercourse and the topic of this video about the different types of sexual disorders. There are 4 different kind of classification for sexual dysfunction. The first one is actually the desire or lack of something we'd consider terms or coined termed as more decreased libido, not wanting to have intercourse. This can happen for a lot of reasons. It could be a self-confidence issue. It could be that there's pain with intercourse. If you're doing something that's painful, you're gonna further and further just want to get away from it. There can be underlying issues and or obstacles in the relationship that needs to be worked on. It can also be more of a hormonal deficiency, a testosterone deficiency, or just taking the time to do it. I will say I went to a conference a bit ago, and this lady kind of broke it down, saying that sex is like heroin for women. The more you have it, the more you want it. The further away from it, the less likely you are to want it. And so sometimes it's actually just a matter of getting into the routine of it and going through the motions to trigger the brain and kind of reset that. The second type of sexual dysfunction is more of an orgasm disorder. So it's the absence or delay to achieve an orgasm. And treatment for that can, the first thing I do is always a detailed physical exam and a detailed history, because there can be medications in your diet, there can be the type of diet, elevated blood sugar can decrease blood flow to the area, making it very difficult to achieve. Sometimes it's medications that you're on. And then looking at to see about how the blood flow is to the area. Sometimes there can be a type of interruption with dermatological issues or obstacles with the vulvovaginal tissue. The third one is more of an arousal disorder. So your brain is into it, but your body's not doing anything. And so that can be things that I hear frequently is not being able to get wet or to have the proper lubrication. Once again, just the mind being into it, but the body not physically being into it. So again, that would be more of a detailed history and physical exam to see if there is a specific reason to or a reason for this, and kind of really narrowing in on that diagnosis. And then lastly is what I spoke about in my last video, which is all about pain disorder. So that's dyspareunia or pain with intercourse. It can be superficial, it can be deep, it can be a combination of both. So having as much characteristics of it really is going to help your practitioner kind of narrow in and see what exactly is causing that. The various causes is more of a skin layer or just the decline in estrogen levels in the vaginal tissue, more of a nerve dysfunction or entrapment, muscular, so pelvic floor overcontractility, or even there could be a gynecological obstacle such as an ovarian cyst, a large uterine fibroid, or dermatological diagnosis of lichen sclerosus or lichen planus. Depending on which disorder you have and kind of depending on your physical exam and your history, really helps us narrow in to say what would be the best treatment for that. So some non-hormonal treatment options for more of a skin kind of area or bringing blood flow to the area or hydration. Something we use is hyaluronic acid. You guys may have heard this or have seen this a lot. We use it a lot in makeup products. It's a type of overhydration that really helps kind of keep in the moisture and is really good, especially when sometimes you're on medications that are anti-estrogen. So, dealing with the decline in estrogen in the vaginal tissue normally helps with moisture. So this is a good replacement of that and can be found both commercially over the counter that you could purchase from a few companies in the United States, or it can be something that can be compounded, more prescription strength with your practitioner. Other options include the laser fractional CO2 laser, which delivers energy to the tissue, kind of helping with hydration, helping the tissue to be able to absorb more hydration, as well as deal with some of those dermatological obstacles that may be present. A few other things that Jan had actually asked me to mention. One is this newer medication called Vyleesi, which is used in premenopausal patients, so before menopause. It's an injection that is FDA approved to use 45 minutes prior to intercourse, and that is used for kind of the decreased libido, hypoactive sexual desire disorder. It is newer to the market. It's the only one that's FDA approved in premenopausal patients. I have not had that much personal experience with it. I do offer it to my patients, but there's a few cost obstacles that we've had with it. The good thing is it does not have any alcohol restrictions, which we've seen with more of the Addy, which is an oral medication that's needed to take daily to help with decreased libido. These are two types of medications that are newer to the market, so I tend to wait a little bit. I try to over-inform my patients, but I wait a little bit for their secondary and third kind of trials to come out to really see how it works, and to really learn more about the side effects profile and stuff. Another one that Jan has asked me to speak about is the Her Synergy, which is over the counter. It's a Mediterranean herbal complex of fenugreek that really helps increase testosterone production naturally in women. I'll say that I actually have. I typically in my practice I use more of just fenugreek over rather than the Her Synergy, but I like the idea of it put together. It increases nitric acid, so oxygen flow to the vulvar-vaginal area, and decreases blood glucose and inflammation. There's small clinical trials where looks very promising. Like I said, I've used fenugreek for quite a while, and it's tolerated well by patients. I just say that I've had a lot of patients who've had GI upset with it. And so I tend to have my patients take it 3 times a week, not daily, just to help with that. Other things that I've heard quite a bit that have really helped is ginseng, maca root, which is really helpful, again, with just decreasing inflammation or increasing blood flow to the area. I think it's really important, though, to understand kind of why and addressing the why before really talking more about treatment options. So I'm happy to do more videos on the specific diagnosis of decreased libido or whatnot, if that's helpful for the group. Again, these videos are for educational purposes. They do not take place of an exam or communication with your primary practitioner about these things.
Girlfriend, thank you so much for listening to our podcast. I hope you found some nuggets to encourage you and give you hope. Make sure you subscribe to the podcast. You never want to miss an episode. And we'd love to know how we're doing, so please be sure to leave us a review. Until next time, this is Jan James encouraging you to remember there is hope after breast cancer. See you next time.